Hi, this is part 2 of our adrenaline insufficiency with Ronda Smoker. This video is crisis. We're going to discuss what happens in a crisis. So, Rhonda, what are the signs and symptoms of a crisis?
Signs and symptoms are headache, dizziness. These are some of them because everybody's different. Low back pain, stomach, leg pain, pale skin, shivering, severe vomiting, diarrhea, lethargy, listlessness, loss of appetite, neurological deficits, confusion, low blood sugar, low blood pressure or high blood pressure, seizures, cardiovascular collapse, may present with like shock-like symptoms. So on my paper, I have down that deficits change and that they can run high, and think crisis, don't question, inject.
Okay, so what can you do to prevent a crisis?
Learn your body's symptoms, learn your low cortisol symptoms, take your oral medication, nausea medicine so you don't throw up. Take every precaution that you can to avoid it. Avoid stressful situations if possible, like sirens and things like that.
Yeah, I think they just went down Main Street. Yeah. So, what's the difference between a stress dose and a crisis shot?
Okay, a stress dose means if you lose a family member, or if you know you have an event coming up like a wedding, or if I was to go to my daughter's ball game, I would.
So even a good event that we wouldn't consider, like the normal person wouldn't think is stressful to somebody who is having adrenal insufficiency.
Correct.
Okay.
So you would stress dose, which means you would up your hydrocortisone, your oral dosage, 2 or 3 days prior, the day of, and then maybe a day or two after, especially the loss of the loved one. And then wean yourself back down to your regular dose. We would also do that if you're getting ill. You would raise your hydrocortisone over.
Because you can't take regular medicines or over-the-counter drugs?
Because there's a lot that interacts with the hydrocortisone.
Okay. So what do you do during a crisis if you think somebody is in a crisis, or if you think that you're in a crisis?
Inject the emergency shot.
So you have it.
It's better to. The emergency shot only stays in your system 5 to 6 hours. So you don't have to be afraid of overdosing them. It's better to be safe than sorry. Every second, every minute of every hour counts, and this little shot will keep our organs going for 5 to 6 hours until emergency personnel can take over.
Okay. Now, when you do a crisis shot, does that use the whole vial? Is it a one-time use?
Yes, you have to use the whole vial, the whole 100 milligrams, 2 milliliters, and you always have to carry 2 of them on you, and at least 2 needles. I carry 4 needles, and 2 of the crisis shots at all times, and then on the bag it clearly says that the medication is in there. It clearly says I'm
adrenal insufficient. Yep.
And it also says ask about life-saving medication. So there's no question if they can't read, then they have a problem. And then also inside I have all my emergency information, all my medications I'm on, allergies, things that would be of importance, because when you go into crisis, most of the time you're not able to speak. The other thing is always have the ID band on.
Right. So is there instructions inside the emergency kit on how to give the shot?
Yes.
In case a stranger or somebody on the street walks up and sees that you're needing this shot?
It's just like this. And
so it's step by step, right? So anybody could do it?
Yes, anybody could do it. And it tells you exactly how to do it. And then this page is where I had signed, and my endo had signed giving permission for anybody to do it, and it also has step-by-step on the back how to do it.
Mm-hmm.
All of this is in my emergency kit. All of this is in my folder that hangs up for when the ambulance crew comes in. They can grab this and they take it right with me to the hospital, and that has all my information in it as well.
Okay.
And it tells them right on it, grab emergency kit, grab purse, and grab me.
Okay. Now, what other precautions besides those there do you have? I know, but what I'm asking is about your cell phone. Like, you have a way that they
On my
can
cell
see
phone,
everything.
They can hit emergency, and then it pulls up my medical ID, and that shows all my doctors, all my surgeries, all my diagnoses, all my medications,
Even if you have
allergies.
a passcode, or anybody can get in and see
Anybody
your
can get into
emergency
it,
stuff. Okay, that's awesome. A lot of people don't realize that. That's why I wanted to put that in there, because I didn't even know that till you showed me. So, okay,
It's very
so
easy on the iPhone.
what can, well, you did kind of go over what can trigger the crisis. You said weddings, any kind of,
Any physical stress,
any kind of
emotional stress. Somebody could come up behind you and
scare you.
spook you and throw your whole system out of whack.
Yeah. So, how many crises have you been in that you know of for sure?
2.
Okay, and what happened?
The first one I fell and got cut up pretty bad. Fell in my dining room, and I still have the scars on my wrist.
Mm-hmm.
I got cut up on my leg. That still looks like a fresh cut, but it's red, but there's no scab or anything.
Because you don't heal well with this disease,
No,
correct?
You don't
Okay.
heal, and you bruise easy. I had fallen. It was over Thanksgiving weekend, so the endocrinologist, nobody was in there, and so I was stress dosing. It wasn't helping. I still wasn't feeling good, and then I ended up calling the Mayo Clinic because they have 24-hour on-call
Mm-hmm.
doctors and nurses, and then they walked me through. That was my first time ever doing a crisis shot, and they walked me through like how to do it. And I did it, and then I thought I did it wrong because it was so painful, and they said no, I did everything right, and I had to drink plenty of water and stay hydrated, and then after that I was fine.
So, that was the first one.
That
What
was
about
the first one.
the second one?
The second one started on November 30th, and it actually started a little bit before that where I wasn't feeling good, so I started stress dosing for 2 days. On November 30th, I was very tired. I had the lethargy. I just wanted to sleep. I didn't want to do anything. And nobody felt comfortable, so I ended up injecting and calling 911. Went to the hospital, and they gave me morphine, Ativan, Toradol.
Stuff you shouldn't have.
Yeah, and they gave me the wrong kind of steroid. And then they continued to do it. They were treating me as if I was having
So even though
and anxiety.
So even though you had the emergency paper there telling them what to do, they didn't follow the directions and they didn't do it.
They did at the ER, they didn't on the floor. And they wouldn't listen to my endocrinologist either over the phone, even though she was affiliated with that hospital. So the following day, they released me, just an hour after pumping me full of more morphine, more Ativan, more Toradol, more of the wrong steroid, and I ended up being awake 26 hours straight. December 2nd came along. I ended up going into the bathroom, and I lost total control of my bowels everywhere.
Was there any warning or anything?
No.
It just came out of nowhere.
No, yeah. I knew that I need to sleep, but I was afraid to sleep because they were saying that I had too much cortisol in my system, or cortisone, and so then I was afraid to take any of my medication because in everything that they gave me, I thought, oh my gosh, if I take anything, I'm going to go to sleep and I'm not going to wake up. And then when I went into the bathroom, it was just sudden. And then after that happened, my mind went into panic mode. And I just had to clean up because I was thinking, oh my God, my daughter can't find me like this.
Mm-hmm.
And her boyfriend, like, they can't find me like this.
Mm-hmm.
So I was trying to clean it up, and then I managed to get to the dining room table and I get underwear and shorts on, and I army crawled because by then my muscles had started shutting down. And I army crawled and I rolled. And I kept trying to use my phone, and I kept dropping my phone. I broke my phone, and then I ended up losing the cell phone. And then I thought, I have to get up into the hospital bed, and I have to get to the house phone. I got to the house phone, and I dropped it on the floor because I was so shaky and weak, and I felt like my arm weighed 1,000 pounds, and I felt like there was just tons of weight on me.
Mm-hmm.
I probably fell 5 or 6 times. I don't know how many times I fell. And I just kept rolling and crawling and rolling and crawling. And then at that point, when I dropped the phone, I just laid here and thought, this is it. You know, I watched 3 people pass in the past couple years, so I know what happens. And I thought, this is it. You know, my worst nightmare is coming true, and it's going to be one of my kids that find me because I had an AVM as well. So then, to me, it felt like 5 or 6 hours. And then my daughter and her boyfriend ended up stopping just randomly for something and thought I was in here resting, and then they found me. And they said it looked like I was having a massive stroke.
And luckily she had come in to check on you.
Yeah.
Yeah.
And it only ended up being 48 minutes that I was alone.
Mm-hmm.
So all of that happened, and everything had shut down in 48 minutes time. The head EMT and the cop were the first ones here, and you know, she said, I'd never seen her like this, and she's been in an ambulance with me since 2001.
Mm-hmm.
And you know, it's a scary thing when you're by yourself and you can't get help.
Right.
But you know.
And you knew everything that was happening, but you just couldn't.
I just didn't have the
say
strength. I couldn't talk. I couldn't, you know, I was trying. It took everything I had to even try to talk at all. And we ended up going to a hospital on the New York side, and, you know, they went by protocol in the ER. My sugar was like a 30.
Wow.
In the ambulance, and I've never had low sugar. And then they ended up running the solo quartet immediately. And then by later that night, I was starting to be able to talk again, but I couldn't move anything.
So you were still like unable to move, like even your head or anything?
I couldn't move my head at all, just a little bit to the left.
Were you able to control, like, were you able to talk at all at that point, or?
I was able to talk, but not
clearly
yet, or real loud yet. They were crushing pills up, feeding it me through applesauce really slowly.
What about like
water.
being able to open and close your eyes and stuff? Were you able to do that at all? Or?
I had like 20 and 30 to the side where I could see, where I would try to follow their fingers, like it was way off.
Mm-hmm.
And them telling me, you know, raise your eyebrows or
things like that.
Like I had nothing, like my whole face would just start shaking. I couldn't do anything.
So how long did it take for you to get to where you could move again and get control back?
Well, December 4th, when I was in there, I was trying, you know, to get my hands moving, get my feet moving and everything, and, you know, they kept coming in like every 2 hours to do a neurological exam, and like my whole hips would start shaking.
Mm-hmm.
Then I ended up going into what they call, I went down for a CAT scan, and I kept telling them before they did the CAT scan, I said, you guys have to let my body rest, you're pushing me too hard.
Mm-hmm.
And the doctor just wouldn't listen to me.
Mm-hmm.
And he thought, you know, it was seizures, and that I had a really bad seizure, and that's what caused all this. And I said, no, my seizures have been under control since 2005. It is not that. It is the adrenal insufficiency. I need the hydrocortisone.
Now, Have seizures ever caused paralysis?
Not for me, no.
I didn't.
And I've had multiple grand mal seizures within 24 hours, and no. And if he would have done, some research, a lot of times it does cause paralysis, and it does cause amnesia during crisis, and sometimes it's permanent damage.
Yeah, because it starts slowly shutting down all your organs, correct?
Yeah. And so I went down for a CAT scan, and then when I came back for the CAT scan, I was unable to speak at all. So then my voice is gone again. The nurse was yelling in my face, "Ronda, talk to me. Ronda, what happened?" And I could hear her. I couldn't say anything. I couldn't do anything. All I could do was lay there. And I guess they had my arms crossed because of transferring me from the bed to the cot and from the cot to the CT table.
Right.
I guess my hands were squeezed really tight, and they had to pry my hands off to get my arms down because of my IVs and stuff. And my cell phone was laying beside me on the bed, and I could hear the vibration of my daughter trying to call me. And I couldn't cry. I couldn't
do anything.
It was like, they said it was like I was physically there with my eyes open for over 3 hours, almost 3.5 hours. I never blinked once. They said I basically just was staring at the ceiling the whole time. I remember her yelling at the doctor, saying, "How are you going to feel when her 17-year-old daughter comes to see her tomorrow? And you have to tell her her mother's gone because you failed to listen to her mother." And finally, he let his pride down, and I remember another voice being there, and it was the ICU doctor. And I guess he poked me with a paper clip, and had opened it up, and there was no reflex, there was no response. Shined, the light into my pupils. There was nothing, but I had a glaze over my eyes. So he ran 200 milligrams of Solocortef, and I remember hearing the hospital,
which is double what you have in your shot.
Emergency kit, yes.
Yeah.
And at that time, I had no IVs going through me either. They stopped the IV once I got up on the floor that the ER had going. So
this was...
So I went without, and he also cut my regular dose of hydrocortisone in half of my oral. So that probably played like a full part in never pulling me out of the crisis.
Right.
And throwing me into that because they were unaware of what they were doing. And he kept saying, well, it can't be because of Addison's or because of adrenal insufficiency, because her blood pressure's high, not low. Well, it can go high during crisis. And he just wasn't getting that. And the nurse was saying, it can go high, look at this. And I could hear her clicking on the keyboard of the computer and stuff, and saying how she's not going to die on my watch. She said, I watched her stay positive all day on how she's going to get control back, and she's going to be able to move things, and just to move my fingers to push the call bell, how determined I was to be able to push that button, and was able to do it. And I was like, yay, I did it. I couldn't see myself do it, but I did it. But she's seen that. And the hair thinning, we were making jokes that day, and I was just like, oh, I hate how my hair's falling out. I wrote it off as all the surgeries from anesthesia. That's actually from adrenal insufficiency. And they're like, oh, you just got a pretty wig and put it on. And I was just like, no, I think I'll just be fat and bald one day and wear a curly hat. So we were making jokes about it, and then that happened. And they had put my iPad on my lap. They propped it up with my purse, and the aide just pushed play, and it was all hymns. And I remember hearing the hymns, and then just everything just kind of got muffled sounding. And I remember the nurse saying, Ronda, you're not in the Band-Aid shop. you can rest your eyes. You can go to sleep. We're not going to let anything happen to you. You can go to sleep. I still didn't go to sleep. They said I still kept my eyes open. When I came to, it was about 1:30, 2 o'clock in the morning. And I actually scared the aide when I said her name. And she was like, oh, welcome back. And then I was like, she had just got done changing my bedding. And I said, and I didn't even know. And I said, how many times did you have to change my bedding? And she said, 3 times. And I said, oh my gosh, I'm sorry. And she said, no, don't be sorry. And she's like, I'm glad to have you back. And she went, to get the nurse. Well, it happened to be my night nurse was back on. And she said, I'm so glad that you woke up because I did not want to have to put a feeding tube in you. And then you come to and there had to be a feeding tube.
Yeah, that would be scary.
And then, I asked, did an ICU doctor come in? And, she told me about it and told me everything that Joy had told her. And I said I could hear everything. But I could not respond, and even Joy was like, if you can hear me, blink.
Right.
And they said that my one eye would twitch, my one eyelid, but that was it. Where I was trying
But yeah, you were trying.
I was trying to say,
yeah, I'm here.
I can hear you.
Yeah.
But I can't do anything.
Yeah. So, how has this whole acute adrenaline failure affected you mentally and physically? I mean, here it is already. We're into January 20th of 2017, so it's been
A month and a half.
yeah, it's been well over a month, 6 weeks anyway. And where are you at as far as the after effects of what happened on December 2nd?
I'm not totally incontinent like I was. I am partially incontinent. I have to have alarms, and I have to, for my medication, and I have to, when doing the vitals, I have to look at the previous ones on BP and heart rate and what all I'm supposed to do.
Mm-hmm.
And because my mind is very confused still and not working, from being on such a high dose of hydrocortisone in the hospital after the weight coma happened, then they never stopped the hydrocortisone through my IV. I ended up going into 5 crises where they had to pull me out and put it directly into IV. Mercy flight, that threw me in. A family member saying that I overdosed was why I was there. That threw me into a crisis. That was an emotional thing, and they actually took my phone away that night, and the night nurse gave it back to me. But so now at home, I have the bedside commode right against the hospital bed. I have 2 walkers. I do not walk without the walkers. Sometimes I will just like a few feet if somebody's here, but if I'm by myself, I don't even leave the room. I'm too afraid to go venturing and touring around.
Right.
In case something was to happen. I do have my life alert that I wear when nobody is around.
So when you're here by yourself, even though you don't leave the room, the lifeline is right there.
Yes, and my house phone is right there, and
Your cell phone.
I learned a lot by being in the hospital. For that week, I could feel the signs coming on, the pain going up through my back, through my neck, up through my head, the shaking, I felt like the inside of my body, I could feel like the twitching and the shaking coming on, and I was just like, you guys need to hurry. I need the Solocortef. And after the weight coma, I mean, they had it there within 5 minutes, and they were pulling me out with like 45 milligrams, which is for a child, but then again, they're putting it right through my eye,
so
right into my vein.
Yeah.
And they also had it dripping through my IV. They never stopped the IV until I got discharged. And that was thanks to the ICU doctor. I do remember when the hospitalist argued and said, couldn't that kill her? And he said, at this point, what do we got to lose?
Right. Because you were already shutting down.
Yeah, it's either going to pull her out or it's not going to help her at all.
And thank God it pulled you out.
Yeah, it pulled me out. After that, I could move my hands, I could move my legs, I could turn my head.
It's amazing.
I had pain in my shoulder because I dislocated my shoulder.
Crawling and falling
and everything.
Yeah.
I didn't know that. I had physical therapy. Every Thursday I fast. Every Friday I have blood work done. Testing
visiting nurses that do that. Yeah.
They take my cortisol and my ATCH. I have to have help with my showers. My meals prepared for me. I have snacks in here. I also have been diagnosed with hypoglycemia, and I have to check my sugar 4 times a day. My sugar
Now that's
goes
something
up and
new.
Down. Yeah, my sugar goes up and down, up and down. And if it does that and continues to do that, like jumping up to 200s and then dropping down, to the 50s and 60s, that can end up leading to where I end up with Cushing's on top of it, and we don't want that to happen. So I have to go by the glycemic index chart on what I eat.
Right.
So now I'm on that, and I'm craving a lot of salt. Like, I want a salt block that I can just lick beside me. That's another symptom of Addison's, is craving salt. And I never was a salt eater. I always hated salt. Now I can't get enough salt. I have to increase my protein. It's not so much watching my sugar, it's watching my carbs and going by that
Glycemic index.
That glycemic index.
So kind of like a
Trying to
diabetic.
keep it, yeah. Well, opposite, but I got to keep it level between 70 and 126 and try to keep it right there between those two lines.
She does. So in other words, you don't want it to drop below 70, like in the 50s, and you don't want it to go to 170 or
Right.
600 or anything
You don't want it
above.
going up and down.
Right. So you want to try and keep it level.
And my heart has been pretty much in arrhythmia and out of whack. A lot of tachycardia with it. I'm having problems with my blood pressure. It's staying, wanting to stay low. Days I'm taking Florinef 4 times a day. The Florinef is what replaces, the dopamine and the aldosterone that your body would make to maintain your blood pressure that I don't have. So the Florinef is what we do to replace that, and then the hydrocortisone to replace the cortisol that my body can't make.
Okay. All right. Well, thanks for your time today. We will get back to this tomorrow with part 3.